Hello, good morning students. My name is Dr. Ashik Hussain and I am an assistant professor at Rashid Latif Medical College. I would like to draw here in this video brachial plexus in its most easiest form, how we can draw and how we can remember the names of the branches. So I would like you to remember my mnemonics which I'm going to tell you, and these mnemonics are not I didn't design them, most of them, but a few are designed by me. So I would like to appreciate those people from whom I got this idea. So this is what you have to do. You need to draw 3 parallel lines. Got it? What you are going to do, you are going to make a branch of superior most and inferior most line. Then what you are going to do, you have to draw an arrowhead. But make sure the peak of the arrowhead should exactly match the middle line. Then you have to cancel this arrowhead, the superior part of the arrowhead, like this. Okay, then continue with this. So what you are going to do, you are going to draw another arrowhead, but this time the peak of the arrowhead, it should just below the middle line. Then you have to cut this superior part of the arrowhead like this, not completely, rather in this manner. And what you are going to write here, you are going to write marmu, M-A-R-M-U. So this is all of your brachial plexus. So how to remember the names of the branches, which I'm going to tell you within a minute. So first of all, you have to write C5, C6, C7, C8 and T1. So these are ventral rami of C5, C6, C7, C8 and T1 spinal segments. So what you are going to do, you are now, just for case of division, these are roots. Then we have got trunks. Then these are divisions. Then here we have got cords, and these are branches. So the mnemonic for remembering these root division is Randy Travis drinks cold beer. R for roots, T for trunks, D for drinks, D for division, C for cords, B for branches and beer. So this is the main structure of the brachial plexus. I hope you got it, how to draw it in its most easiest form. Now I would go for the number of branches, how to put them in. So as we know that phrenic nerve, its root value is C3, 4, 5. So actually C5 here, it also participates in the phrenic nerve, so I would like to put it here. So the easy phrenic nerve 3, 4, 5 keeps the diaphragm alive. 3, 4, 5 keeps the diaphragm, because phrenic nerve supplies the diaphragm. Then we have got long thoracic nerve 5, 6 and 7. Long thoracic nerve. This long thoracic nerve it actually supplies the serratus anterior. Serratus anterior is a muscle which is also called a boxer muscle. So what I do, I imagine, or I suppose that a boxer is practicing in a gym. what he's doing to maintain his rhythm, what he's actually doing, he's punching and he is saying 5, 6, 7, 5, 6, 7, just to maintain his rhythm. So it always reminds me, I always remember that 5, 6, 7, 5, 6, 7. So 5, 6, 7 is actually boxer is doing. Boxer is muscle is serratus anterior, and serratus anterior is supplying by the long thoracic nerve. So this is how I always remember the root value of the long thoracic nerve. And beside that, here we have got another branch. So I better drop branches with the red marker. So this is dorsal scapular nerve. This is also called nerve to rhomboids, because this nerve supplies the rhomboid minor and rhomboid major. So root value becomes, because it is originating from the C5, so C5 is the root value. So 3 nerves actually originating from the roots. Phrenic nerve 3, 4, 5 keeps the diaphragm alive. Then 5, 6, 7, 5, 6, 7 long thoracic nerve. Then here we have got dorsal scapular nerve. It supplies the rhomboids. Then we have got trunks. There are 3 trunks: superior trunk, middle trunk and inferior trunk. And in this case, this superior trunk, my mnemonic is that superior trunk, she thinks of herself superior. Superior trunk, she thinks of herself superior, because this one, it is, and it has got valid reason for that. Why she thinks of herself superior? Because she is the only trunk which gives 2 branches, whereas no branch is given by the middle and inferior trunk. So superior trunk, she thinks of herself as a superior because she is the only trunk which gives 2 branches, and those 2 branches are supra and sub. Supra and sub, supra and sub, supra and sub, up, down, up, down, up, down. Supra means up, sub means below. Supra and sub. Supra means suprascapular nerve, and sub means nerve to subclavius. Nerve to subclavius. So with the trunk, we have got a mnemonic that is this superior trunk, she thinks of herself as superior because she's the only trunk which gives 2 branches, supra and sub. Supra means suprascapular and sub means subclavius. Then we have got divisions. And regarding division, I said divisions they don't give any branch. They don't give any branch. So divisions don't. Simple as that. Okay. Then we have got chords. Regarding chords, here before chord, what I would go for this marmu. I wrote here marmu. M for M, musculocutaneous. A for axillary. Here you see axillary is originating from the posterior chord. R for radial. M for median. And U for ulnar. So chords, in case of chords, we have got lateral chord, we have got posterior chord, we have got medial chord. So the question is, why this is lateral chord, why this is medial chord, and why this is posterior chord? Because this red color, as you can see, it is denoting here axillary artery. Actually, axillary artery is present in here like this. So the chord which is lateral to axillary artery is called lateral chord. The chord which is posterior to axillary artery is posterior chord. The chord which is medial to axillary artery is called medial chord. Okay. So this is lateral chord. This is posterior chord here. And here we have got medial chord. I know that my video, its length is going to be a bit longer, but you have to bear with me and you have to watch this video till end. Lateral chord, posterior chord, medial chord. So in case of medial chord, you can see one branch is already here, which is musculocutaneous. So lateral cord, one branch is musculocutaneous and other one is this lateral root of median nerve. This lateral root of median nerve, this is medial root of median nerve, and here is median nerve. The word median word actually means something which is exactly within the center. So because this nerve is, its contribution is from two cords. It is getting its fibers from the lateral cord and medial cord, and for example 50 fibers are coming from here, 50 from here, and here we have got 100 fibers. So lateral cord and medial cord both joining together by one root, that is lateral root and medial root, and resulting in the formation of a median nerve. Got it? So lateral cord, musculocutaneous nerve, and lateral root of median nerve, and third branch is lateral pectoral nerve. Got it? And whereas in case of median nerve, one branch is already here. Here you can see ulnar nerve. Ulnar nerve is a continuation of the medial cord. Here you can see. Whereas second branch of the medial cord is here, medial root of median nerve. So mnemonic for branches of the medial cord is what I used to tell my students, that medial cord is mad about word medial. It means that out of 5 branches of the medial cord, 4 branches they have word medial in their name. For example, here you can see medial root of median nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, medial pectoral nerve. Okay, 1, 2, 3, 4. 4 branches are having word medial in them. Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial pectoral nerve, and medial root of median nerve. So, and 1 is ulnar nerve. So medial cord have got 5 branches. Out of those 5, 4 are having their name starting with the word medial. Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial pectoral nerve, and medial root of median nerve, and rest you know that ulnar nerve. So 5 branches from here. Whereas posterior cord, here you can see the already 2 branches are already drawn. One is axillary nerve and other is this radial nerve, and beside that here we have got 3 branches, and upper subscapular, lower subscapular, and then we have got middle subscapular, which is also termed as thoracodorsal nerve, which is a branch which supplies the latissimus dorsi. So again, quick review: roots, trunk, division, cords, branches. In case of roots, we have got 3 branches, which is long phrenic nerve, 3, 4, 5. Then we have got long thoracic nerve. Here we have got long thoracic nerve, which is a branch which is supplying the serratus anterior, and it is called boxer muscle. 5, 6, 7 root value. Then we have got superior trunk. Superior trunk is the only trunk which gives branches, supra and sub, supra and sub. Then we have got divisions, divisions don't. Then we have got cords, lateral cord, posterior cord, medial cord. In case of lateral cord, here we have got already musculocutaneous nerve and lateral root of median nerve. Then we have got lateral pectoral nerve. Then we have got medial cord. Medial cord have got 5 branches, and out of those 5, 4 are having word medial in their name. Medial cutaneous nerve of the arm, medial cutaneous nerve of the forearm, medial pectoral nerve, and we have got medial root of median nerve and ulnar nerve. And for posterior cord, we have got axillary nerve here, and here we have got radial nerve, and beside that we have got upper subscapular, lower subscapular, and thoracodorsal. So this was a full concept. I would try to make another video in next section about the concept, what actually happens in case of clinicals. For example, Erb palsy and Klumsky palsy. What are those palsies? So I hope you would like my video. And I would like to make it more simple if you really insist in another video. Thank you very much.